Okay, so here we are, and we're using a massage table now, but the way that Anne is laying on this table could also be a person's bed in a care home, or if they had like a hospital bed at home, if they were convalescing, or even just like a single bed or something like that. But I would like to show you a routine that would help mobilize the spine, mobilize the hips, and get somebody sort of feeling like their body was moving better. And so if you have somebody who's bedbound or that they aren't moving well, maybe they're convalescing, this would be a great thing to be able to do for them. And it's quite simple, but it's also very relaxing. And when people lie on their side, they feel very comforted. So as long as you have a pillow here that is a good height, this is a good height for Anne's neck. Her neck is fairly neutral to her spine. She's laying in a comfortable way. I could have a pillow underneath her leg if I wanted to, but I'm leaving her without a pillow in between her legs, but she says she's comfortable this way. So just to start, because a large theme here is to maintain mobility through the trunk, rotation in particular, side bending as well, you know, for gait, for walking, for mobility that we have emphasized through this program. If you pick up the person's top arm, so in the case that she is laying on her left side and she's got her right arm here and I've got her right scapula and I'm actually holding her scapula and I'm just kind of, as I draw her arm towards me, I'm just sort of sliding, helping to slide her scapula across her rib cage. So I'm just kind of mobilizing her shoulder. So if you had somebody who had like a frozen shoulder or their shoulder mobility was poor, this is very kind of nurturing and it's not too invasive. If it felt like that was too much mobility for them, you could just make it smaller. You know, you can just, you know, really bring it into the core, bring it into the thoracic cage and just kind of like mobilize more of just the rib cage and the whole shoulder girdle complex and just support it with your other arm. I'm supporting it here just into the armpit, and here I have my hand just sort of underneath, my thumbs underneath the armpit, but I'm just guiding her arm, her shoulder. How does that feel?
I'm fine. Very nice.
Yeah,
very relaxing.
Very relaxing. And so, you know, I've done mobile visits to aged care homes where, you know, the person actually wants to be lying in their bed when they're receiving their treatment, you know, and maybe they're not oriented to getting onto a massage table and having all that set up. So you could have them in their clothes, just loose fitting clothes. You could request that. And then now I'm starting to move back and forth. So this is like reaching, right? And I'm just sort of feeling like if you've got someone who doesn't move well, this amount of rolling and shifting on the rib cage, just kind of, you know, kind of holding on to the ribs and just kind of pressing into the ribs, not too much, but just enough to kind of get some mobility through the trunk. I even feel there's a little bit of resistance now that I get into this midsection here. And so I'm just going to kind of work over there for a while. My fingertips are going down towards the spine on the same side that I'm on. So that would be her right side of her spine. And I'm just kind of, you know, using my fingers to just knead into her back muscles there. So this is something that you could do for, you know, 5-10 minutes on each side, you know, of the back, and then start to incorporate the lower leg. So now I'm going to, you know, maybe do some squeezing of her arm, and I'm going to pull her arm out like this, and I'm just going to kind of, you know, just give her an indication to, wow, look at that. Look at how much movement you have in your shoulder now. So, and that's very simple. Now, if she was having trouble reaching overhead, I think that some of that work that you did would sort of free up some of the rotator cuff muscles, subscapularis in there, maybe the teres, getting into the lats and just kind of, you know, working them gently through there, just massaging in there some of the tight muscles, and then just really supporting the shoulder and seeing if you can help to bring it up and just, you know, lengthening through the rib cage. You know, a lot of people forget as they get older that, you know, that their arm mobility really is is also, dependent upon how much the rib cage can move. And as you can see, we're getting a lot of motion out of her rib cage now. So then I would just leave that arm to stay there and relax, and I'd move down here to her pelvis. And now I'm just going to connect my hands in through her hip joint here, and I'm just rotating her pelvis backwards and forwards. And so this is the other end of her body. We're not really doing anything different here. We're actually just doing the same thing, and we're just trying to, mobilize the hip. And, I can even take my hand on her knee here and push through the femur, push through the long bone of the leg, and just kind of like rotate her back and then bring her forward here like this. This is a very nice kind of move, and it really mobilizes the pelvis and the sacroiliac joint. Here I have my hand on the sacroiliac joint, and I'm actually just kind of like opening it up as I draw her towards me. And you can see my own movement, like I'm not just statically doing this with my arms. This feels like a completely different move, doesn't it? When I just do it like without moving myself. Yeah. I'm actually in sync. My nervous system, her nervous system, my movement, hers. Like I'm talking and we're working here, but like we could also sync up some breathing, breathe in. And then on this forward action, breathe out. And that would also be very lovely. So if somebody has pain in their spine, you don't have to move into rotation too much. But, as long as you're looking, look, if I go to here, I know when it's finished. I wouldn't force her to go further because she can't go further unless the rest of her is going, right? So if I wanted to kind of, maybe try to get this part here where she maybe is a bit more challenged with the rotation in the lower rib cage and the lumbar spine, then I would just kind of focus on that a little bit. Rocking is highly therapeutic. It really soothes the nervous system, and it's very calming. It really sort of stimulates the parasympathetic nervous system, and people really enjoy it. So there we are. We're just kind of, if you slow it down too, if you go really slowly, that's also very effective. If you were going in to see like an elderly person and you're booking, sort of a 60-minute appointment with them, you can really take your time on this. Just because you're not moving along as fast as you would in a regular session with somebody who isn't elderly and, kind of a little bit weaker or convalesced, can just slow things down, and they would really benefit from that calm, slow, relaxed, methodical movement. So now, here I am, I'm kind of moving back, and you actually have more integration there, don't you? You feel like when you roll back, her back is moving a little bit more. We see her shoulder moving and her head. And that's really just an indication that, she's kind of sensing how much she can rotate here. What else could you do? You could lift the leg and bring the leg into flexion here, into hip flexion. And, you could bring the knee into the chest if you wanted to kind of, stretch out the back of the hip. And that might be nice. And you could lengthen the leg down this way, but you want to be careful about this being challenging for an elderly person. Usually, like I was saying before, one of the first ranges of motion for the hip joint to lose is internal rotation. And then, of course, it's going to be extension as well. Often they have difficulty with extension. So I would ask Anne now just to help facilitate some extension by moving her pelvis forward. Just like trying to kind of thrust her pelvis forward a little bit and letting it go and letting it just relax back. And then take your pelvis forward and bring it back. And take it forward and bring it back. And now look at that. You can see that movement is actually moving all the way through her. Anne moves very well, and you couldn't expect this for everyone, but this is something you can do for anyone, not just a person who is elderly or in an aged care home. This would also be very beneficial for a pregnant person, somebody who had back pain or somebody who needed to have more mobility in through their back. And again, coming back to rolling in through the hip, it's just starting to feel more and more kind of fluid and better. So I wouldn't do that much more on this side. You potentially could, work in the shoulder a little bit more and maybe, work down into the spine a little bit while she's on her side here, just to, kind of mobilize these vertebrae here. If I hold her arm like this and just let her give me all her weight, here I have it. And there I'm just kind of like motioning. And again, just like the exercises we were doing in the wheelchair, this is just a way to kind of make the spine move from using the arm as leverage, right? You can feel that in your spine when I do that?
Yes. Yep.
Yeah, I'm just kind of, turning you a little bit, and your vertebrae is just sort of moving a bit here. So, I don't know if you could be at the head of a bed for somebody if they were lying in a hospital bed or something like that, but it's just some ideas for you to have a very functional focus to your treatment. And, relaxation comes as a byproduct of being slow and methodical. So, it's still a relaxation treatment without, really, but at the same time, it's also benefiting her motion. So now I would ask her to turn over, and so she could do that however she could. She could start to lift this leg maybe a little bit, and then slide herself over onto her back. And then I would have her turn over and do the other side. So once we had done the other side, though, I would have her lying here on her back, and I would do some other things. So now Anne is lying in supine, and, if you had been doing more Swedish massage during the session, say in more of a clinical setting or a setting where you had a table set up with massage sheets and linens and the person had gotten undressed and was on the table, I did the sidelying routine for the back and for the neck and just mobilizing the pelvis. And now she's lying on her back. She's turned over. And really, again, I'm just looking at, just doing some gentle extension of her neck. I've got my hands sort of underneath her vertebrae here, and I'm just scooping up, and it's just kind of this wave of movement, and I'm just lifting and trying to get a little bit more kind of extension of her upper thoracic spine here, and then working up in through her neck as well. So that's very relaxing. And, like a person who is aging, often will have some level of arthritis, and the cervical and lumbar spines are usually the two areas where that takes place. So, you can often find that, as you move along these cervical vertebrae here, that you might find an area that feels a little bit like it's kind of sticking out a little bit more, or a little bit what we would call subluxed, or the transverse process has, just feels more tender to the touch for the individual, the vertebral segment. And so often that can be because, they've had like some osteophytic growth, some calcifications along the side of the vertebrae where they've maybe had a lot of compression over their lifetime, or posturally they've put more kind of movement into that side than the other. So it's just good to just move along and do some circular kneadings and just mobilize that area. If you're going to assess, before you do too much other work with the person's head, you could just take your hand and you could just roll the head to one side. And, she has pretty good range of motion. I'm going first here to the left and seeing. And I'm not really looking for the furthest range of motion. I'm just kind of looking for the quality of the range of motion. And now this side over here seems actually easier. And it makes sense because often people do turn better to their more dominant hand, and she's right-handed. So the other thing that you can do is you can pick up the head and you can just move it from side to side a little bit and see how much side to side movement happens. And that's how much movement is happening sort of in the neck and in the upper thoracic. And with her, I feel like she actually moves a little bit better to the left than she does with her neck. She's using sort of different parts of her body, you know, to get herself over to that side. So again, there she's taking a breath and, you know, with just revealing that kind of tension, I can just work in here, you know, and do again some circular finger kneadings. Nothing too dramatic, right? You can also use vision, you know, with people, but one thing you want to be careful with older people is sometimes they suffer from vertigo and dizziness. And if you realign in a fairly drastic way how their head is sitting at the top of their head, sometimes, you know, you can trigger a bit of dizziness or vertigo. So, you know, I'm just working in these muscles. I'm not moving her too much. You could get some feedback from your client if they have had any dizziness. And also you have the vertebral artery in the neck, and so you don't want to do too much, you know, really strong twisting. However, I can support her head with my opposite hand, and I can work into the muscles of her shoulders and neck here. So I'm just kind of doing this sort of squeezing here. And a lot of these techniques, you know, we've taught in our sort of, you know, basic classic strokes for intro folks, you know, things that you can do for the chest and things that you can do for the neck. So I'm just suggesting that these are types of moves. You know, I remember when I was in massage, you know, in my first years of practice, and I had a person come to me and she said, I want to have a massage from you every week, but I don't want to take my clothes off. And because I had learned Swedish massage and massage through the college for like, you know, it was like a 2-year program, I had never actually massaged somebody with their clothes on before. And so it felt challenging for me to know what I was going to be doing with this person while they came to my office and didn't get undressed, that I didn't use oil. But these things that I'm showing you are things that can really benefit in terms of mobility and movement and also relaxation. So the idea of having somebody getting undressed for a treatment isn't necessarily the end-all and be-all. And sometimes elderly people feel more comfortable leaving their clothes on because sometimes for them getting dressed is a chore or a task, you know, that they probably only want to do once or twice a day. Getting into their pajamas and, you know, getting dressed for the day. They don't want to do it one more time. So that's something that I would recommend. And then, you know, just some gentle, you know, kind of mobilization of the shoulders, you know, something that again creates this sort of rotation in the head and connects different parts of the body together. You can see her arms are lengthening. I've been massaging Anne's neck and we've done some rotation on her side, and now I have her lying on her back here, and I've asked her to bring her legs up, actually have her feet more or less together, her knees and her feet. She can bring them together. And then I'm also going to ask her to bring her arms up over her head. Now, for some elderly people, this might be challenging. So if they need to keep their arms bent, that's okay. But if they had full range of motion, they could come up to wherever they felt comfortable, right? And I could help them a little bit by supporting the shoulder blade and moving it inferiorly, or you know, scapular depression is what it's called, you know, just to kind of help, you know, less strain in the shoulder. So now what I'm going to ask you, Anne, is if you can just tilt your legs from side to side. So Anne can really tilt her legs. Look at how far she can go, and then bring them up and then to the center and go to the other side. Yeah. And so what you'll find is, you know, somebody will have sort of the ability to do this easier on one side, and then, you know, when they go to the other side, it might be a little bit more challenging. So you can actually feel their chest and kind of help them. But if we thought that this actually was a similar thing to getting that rotation through the spine from the hip joints, then what we could do is have her come over like this and kind of extend her through her shoulder. And then as she comes over like that, just kind of extend through the shoulder. How does that feel?
Nice.
Yeah.
Yep.
Yeah, so it's just very relaxing, but it's actually, again, when I show my elderly clients something like this, they're like, wow, that feels good. I never thought about doing that. If people aren't used to moving themselves, you got to get them kind of curious and kind of excited about doing certain things. And often, if movement gives pleasure, that's a big motivator. So now what you could do is just let her have a bit of a shoulder rest, right? Like having the shoulders up like that, you need to be aware of that. And if she wasn't able to bring her shoulders up very far at all, she could just do the same movement without the shoulders, just dropping the legs down. It just doesn't, have quite the same effect. And then what we could also do is have you spread your feet now. So your legs your feet go wider. And so your knees are bent, but your feet are just wider. Yeah, there you go. And now what I want you to do is just bend to the side again. So tilt. So it's like you're tilting, right? And now this is internal rotation of the hip. So she's internally rotating her left hip, and then she's going to come back. And then I want her to really engage her right leg and tilt to inwardly on that side. And if you had somebody who was having hip problems, they might find this challenging. She can go to a real end range there, but just sort of go back and forth and do that. But do it in a way where it's not just your pelvis that's actioning. It's actually that there's kind of an engagement of your foot on the table, pushing through yourself a little bit. Yeah. Excellent. And then do you feel how when you do that, when you ask now your left foot to start to initiate that movement coming over to the right, that you feel it come through you more?
Yes.
It's connecting to you more. And so this is really what this course is about, is this concept of using the body together, in a more holistic fashion. And so here we are. I can feel the rotation all the way to her neck. It's fantastic. Does that feel good as well?
Mm-hmm.
Yeah, so there you go. So this is a really nice thing to do for you, and you're really helping out your client, and they benefit from it. So now I'll just let you extend your legs long again. So when you're working with elderly clients, it's always good to keep in mind, what would be the kind of things that would be challenging for this person. Now, we've already addressed things like arthritis, and things like arthritis can happen in the neck commonly, in the lower back, in the hands, in the feet, in the knees, in the joints, large joints of the body, even in the TMJ. Also in the shoulder. So just gentle mobility, as I have said before, would be your best protocol. And other things could be circulatory problems. So in that case, you would want to, if someone told you that they had, poor circulation or were getting sort of altered sensation in their feet and hands, you could work on their feet and hands, but you could also do some flushing out and do some effleurage and petrissage with oil or lotion on their body. I do want to say, though, that if you're working on someone older, especially if they're in their 70s, 80s, or they've had some kind of sort of chronic condition that has reduced their health and their circulation, that sometimes their skin is very fragile. So you do want to use a fractionated coconut oil, or a very sort of thinner oil, something that has a lot of glide to it. If you're not doing that, then you'll get too much friction on the skin, and that could just cause the person to be uncomfortable. So if you end up, needing to use a lotion and you're finding it's drying out on their skin because their skin is quite dry, then you should either switch to an oil, because that would be more lubricating, or a cream perhaps that has a high oil content, or use more, don't allow that kind of real drag on that tender, sort of fragile tissue. When people get older, they can bruise really easily, and they can also, just like when they hit their skin or the surfaces of their hands or their arms, just doing day-to-day things that can cause them a lot of discomfort and take a while to heal. So that's just a consideration. The other thing that I wanted to talk about was digestion. So sometimes when people get older, they get digestion where, say if someone took them out for dinner, the night before a therapy session. We had this happen just this week. An elderly lady was booked into the clinic, and then she phoned us and said, look, I can't get off the toilet. And, like that's not an uncommon thing. And this person was in their 80s. And so, they ate something new. And so new foods get introduced when maybe they're used to having, sort of a repetitive diet of eating the same similar foods all the time. And so they can get sensitivities that way. People can also not be drinking enough water, which means that they would have maybe some constipation. And so maybe you want to help that along. And so I'm just going to show you some things just to do with the gut. And again, the sheets would be over top of the person if they had their clothes off. But in the case of this, I'm just going to place my hands underneath her back, just around the level of her navel, and I'm going to put my other hand. Now, some people might even come in and go, I've had gut pain, or maybe their gallbladder's acting up, or, some people actually who have like some fatty liver disease, will have pain in their liver. So, here I am, all I'm doing is just sort of connecting with the viscera, right? Like I'm just, I have one hand over her navel in my palm and my other hand is underneath. If someone told me that they had pain in their gut, I would literally have my two hands where I had one hand kind of connecting through to that pain point, and I would just be holding and maybe unwinding. So the concept of unwinding is kind of like following fascial pull, just sort of sensing what's happening between your hands and just kind of unwinding the tissue and moving into, an area where you feel like there's tension and just kind of staying with it and just waiting for it to almost release on its own. And this can be very satisfying for the person. You don't really have to get too much feedback about it, but sometimes it's just really a nice, relaxing treatment and people like it. If they're a bit vulnerable, they have had diarrhea or constipation, they might be a little bit concerned about you touching their gut, but you just get their consent first and feel your way along. Now I'm kind of scooping her lumbar spine here too. I kind of have my hand underneath and it's just going like this, and I'm kind of like mobilizing her lower back. And I even like to do this thing where I just kind of like press into the gut, and then as I'm pulling the vertebrae in the same direction, I just kind of like mobilize everything together. And so this is just a really nice, relaxing thing to do for someone. And as you're exploring around, if you're aware of where the organs are, the liver being over here, the pancreas and the spleen back here, the liver comes across the midline, the stomach is here. You also have, the bladder, and definitely incontinence factors with the elderly. And so, you can always address that. And I'm going to be offering another program on, improving the pelvic floor and some of those other things that women are challenged with, especially post-childbirth. So now I'm standing and I'm thinking about, working into her lower abdominal area here. It's on the right quadrant, so this would be near the right ovary and just the ileocecal valve. And I'm just making kind of like some circular kneadings. And I'm just kind of, just connecting with the tissue underneath. But the idea is that I'm kind of following along the pathway of the large intestine. So I've come up from the ascending colon here, where it connects with, like I said, the ileocecal valve and the lower quadrant of the abdominal organs. And then I'm just kind of making a circular kneading along that transverse colon. and I'm coming across first the ascending and now into the transverse. And right here, when I'm here, I can feel that there's a bit of tension. So I'm actually just going to take my hand and just kind of like work underneath her diaphragm. It could just be that maybe she's been coughing a little bit lately, or maybe if she'd been sick a little bit, that maybe that got irritated. And so I'm just kind of scooping my thumbs underneath, and I could actually get her to take a big deep breath in. And then on the exhalation, I could just scoop up underneath that. And yeah, there's a little bit of resistance there. It's tight in there. So I'm just working away, and you know, that's actually, you know, just kind of mobilizing those ribs up above. And that's right where the liver is, underneath the rib cage. It's this huge organ. I mean, it just takes up where my hands are, right in through here. So I'm just going to continue on this path now across the transverse colon. And I'm heading down, I'm coming across this sort of corner of it and the flexure here, and I'm just making some circular kneadings down towards the sigmoid colon and the rectum, right? So that would be the path of elimination. And if you didn't want to do anything as invasive as that, you know, with that sort of more deeper kneading, you could just be very lightly over the bladder here, and you could just be doing some strokes in that up the right side, across the top, just underneath the ribs, and then back down. And just, you know, that's very relaxing to have some work done on the gut. And I really encourage you to hold on to someone's abdominal area. I mean, people often aren't touched here by other people, and it's a highly sensitive area. And it can just be really instrumental in relaxing someone and helping them just to breathe more efficiently. And you can reach underneath and just do, you know, just kind of like a shaking. And yeah. We did a lot of abdominal work in the hot stone massage that we did using stones. And that was also another area where you could look for a routine for this. So I'm just warming my hands now together. You can put a little bit of oil there if you didn't have the person clothed. And then I would just, you know, do a bit of vibration on their abdominal area, just as the person keeps their eyes closed, and you can just guide them, you know, to breathe in and out. Take a few full, deep breaths. In another segment, we're also going to do, you know, sinus problems and deal with also postural drainage. And so this vibration, you know, on the rib cage and around the lungs is also really good for moving fluid, right? So sometimes elderly people have issues with that as well. So you'll be able to consult that later on, you know. They actually do almost like a pummeling on the different lobes of the lung, and then they do like a vibration technique. That's usually how postural drainage is done, but there's quite a few more strategies to that. Okay, and then we're finished up.